Hey friends, welcome to our first episode of Ask Dr. David. I'm starting a new video series where I'm going to be answering questions from our community members. For a chance to have your question answered here on a video like this one, all you have to do is become a member of our channel, drop a comment on one of our Ask Dr. David videos or on any of our posts, our community posts about our Ask Dr. David videos. If you're interested in becoming a member of our channel, all you have to do is find the join button on our channel homepage or also on any of our YouTube videos. Once you hit that join button, you'll see all the perks that we offer for our members, and then just follow the instructions to complete the process of becoming a channel member. Then just drop your comments and we'll be taking a look at all the best questions so that we can put them on our cards here and I can answer them for you. All right, let's get into our first question here. So I have a question from Ali. Ali asks, "Hi, I have followed your videos regarding my knee pain and I'm starting to feel improvement." Yes, that's awesome. Makes my day. "I'd like to decrease weight on my belly, so could you please send some exercises to do? Thanks a lot, Ali." I'm not going to give you exercises, Ali. Here's the issue with this, and this I've preached this so much, I will be repetitive about this process because I think it matters a whole lot. First off, I am so glad that you're better in your knee. That is a testament to you doing the right thing, to you fixing the imbalance. That's probably what's happening. Now, if your weight is so much, usually about 50 to 70 pounds beyond what you should normally weigh, then losing weight does need to become a priority for you. But if you're not beyond that weight, if you're more like just 20 pounds, 10 pounds, even 30 or 40 pounds overweight, then you can still get your knee pain better without dropping any weight. Now I get your question, everybody wants to be in a good weight anyway, so what exercises can you do? That opens up a whole other conversation. You can do virtually any exercise as long as it doesn't hurt your knee, because all you have to worry about is burning calories. When I say this, I'm getting into the health and fitness world and it's not 100% my wheelhouse. I know about it. I was a personal trainer before I did physical therapy. But at the end of the day, if you're burning more calories than you consume, then you're going to lose weight. There's gray areas within this. That, like, in other words, there's certain foods that might benefit you more than others. There's certain times to eat. We got to look at diet constraints. There's genetics that play a role in this. There's a bunch of different variables that we can get into. And I know people watching this might have a strict opinion about, certain foods that you might eat or not eat. I don't want to get into that. What you need to worry about though is first changing your diet and then exercising more. But do not exercise more if your knee is not ready to do so. It would benefit you more, Ali, to go get your knee healthier, since it's already you've got momentum, it's already getting better. Go get your knee healthier so that you can go do more cardio type exercises like walking, running, cycling, doing other gym activities, weightlifting. It doesn't have to just all be cardio, but improving your body composition by getting more muscle can also help you burn calories. That's a very important thing too. Go get your knee better so that you don't have limitations. You don't need specific advice on which exercises are best to lose weight. You can probably sign up for 9 out of 10 fitness programs and be successful with dropping belly weight, but you'll have confidence to do that if your knee is healthy. So fix your knee, set priorities, and don't worry about one thing at a time. It's rare that you can accomplish two things successfully and thoroughly, as far as like weight loss and fixing a knee problem. I'd go for the knee problem first because you're going to be more successful with the weight loss. All right, next question here. We have Mick, who is asking, shoulder injuries where the AC joint had been affected and is loose and clunking. Oh, I'm so sorry you're dealing with this, Mick. What I think he's referring to is what's called an AC joint injury. So let me pull my skeleton over to give you some specifics. Let me tell you about the AC joint. The collarbone is called the clavicle. That's the scientific name for it. And then where it connects out here to this is part of the shoulder blade. This specific section of the shoulder blade is called the acromion. So when we say AC joint, we're talking about the acromioclavicular joint. That's this part right here. This joint can become loose and you can get clunking, popping, and shifting sensations in this joint. This is especially common in people that are like doing sports and they fall on their shoulder. Sometimes car accidents, bicycle accidents, motorcycle accidents. If you fall on your shoulder, you can just stretch the ligaments out and cause looseness in these joints, in this joint right here. And that can lead to like repetitive clicking and popping and all that. I have seen many AC joint patients, and there's surgeries to do this. They'll put a pin in there and they'll surgically fuse the joint essentially so that it doesn't move a whole lot. But you need movement in this joint. It's a joint for a reason. And getting it surgically pinned, in my opinion, is not solving the full problem. You're kind of sacrificing mobility for reducing the clunk and pop, but it usually ends up causing problems in the ball and socket joint down below, because when you reach up, when you reach all the way into the extremes of what your shoulder can do, your shoulder is relying on little bits of motion happening in the AC joint. And if it's surgically pinned, you lose that motion, and that causes more stress and tension and pressure to go through other joints, which sets up another problem. So what you should do to heal properly from an AC joint injury is support it better. You need to do what we call approximate the joint. So what that means is bring the ends of the bones together and hold it there as long as you can throughout the day so that the ligaments can have a chance to heal. And there's a real simple solution for that. Get yourself into a shoulder sling. So this is what it looks like. These you can get anywhere. You can get them. This one you can get off of Amazon. I'll put a link in the description of this video in case you want to get the one from Amazon. But if you have like a Walmart, a Target, a pharmacy that has a first aid department in it, they'll have some version of this. And this one's really nice. I like this one for a specific reason, but they're all kind of similar. Some are they have better materials. Some will have padding and cushioning like this one. Some just have a strap like this the whole way through, and it's not as comfortable. This one even has pockets right here. Look at that, for your phone or your wallet, and it even has thumb loops. I'll show you how to use it. And it doesn't matter what arm you're going to buy it for. They're universal. You can use it on both the left and the right. But you just put your neck through there, and then get your elbow into the corner of the sling here. And then you have your thumb loop here if you want to put your thumb, because it is comfortable. Otherwise your wrist hangs down and it can start to bother your wrist. And then what you want to do, here's the trick, because we got to get that joint approximated for the AC joint to reduce the popping and clunking. We need to shove this up. We need to get the ball and socket up. We need to get the acromion pushed up into the clavicle. So the way that you do that with this shoulder sling is you tighten the heck out of this. You make it as tight as you comfortably can, so that and make sure that your elbow's in the corner. That way it shoves your elbow up, and when you just relax and rest, your shoulder is sitting up higher than it normally would, because without this, gravity's going to pull down and it's pulling the AC joint apart, which is keeping tension on those ligaments that need to heal. But if you take tension off the ligaments, then they'll start to heal. So Mick, you need to be in a sling like this as long as it takes. This is where I start getting questions about, well, how long do I use this? How many hours throughout the day? When do I take it off? Can I shower without this? Yeah, take it off for showers. Take it off when you need to. Whether or not you want to sleep in this is up to you. Generally, when you're asleep, you're not going to be worrying about your gravity pulling down on your arm. But during the day, when you're doing your normal activities, I would get in the sling. You're going to get questions from people, what happened? What happened to your shoulder? But the cool thing is that you're going to be not using your arm as much, which is going to allow your ligaments to heal. And it should reduce the popping and clicking. On average, as I've treated these AC joint injuries, it takes about a month. It depends on how old you are. The older you are, the longer it takes. It depends on how severe the injury was and how long you've had the injury. If you've had this injury for months, years, it's going to take longer, and potentially you might not even heal all the way. If you've had this injury for weeks, maybe a couple of months at most, then you're probably going to get over this a lot quicker, and you could probably get over it 100% and not have to have a surgery. But this little $10, $15, $20 device will save you from so much trouble, Mick. You just have to be using it. That's the common problem, is people forget it. But you need to wake up, put this thing on, have it on as long as you can tolerate throughout the day. It gets uncomfortable on your neck. Take it off for moments, and then put it back on, and you should find that as you begin to move, your shoulder should pop less, clunk less, and if you have pain at that AC joint, it should reduce over time. Once your pain's gone, once the popping and clicking's gone, then you can take this off and not worry about it. Then you got to worry about other exercises to do to get your shoulder blade stronger and your ball and socket joint stronger. But that's a conversation for another day. All right, for our next question, this one comes from Alexi. She says, "Hi, Dr. David. I found your channel yesterday. I have done your 4 exercises and your stretches already. I feel better already. Yay. I just wanted to ask, what are your thoughts on spurs or osteophytes? I only have mild central cartilage loss on both hips, but osteophytes on ball and rim of both hips. What are the causes and how to get rid of them?" Great question. I even brought my board out here because I want to just draw a little bit to help you guys understand how this works. So let's just draw a hip joint first. That's the socket. Let's draw it a little bit bigger. And then here's the ball. It sits inside the socket, comes down like that, and then we call it the neck of the femur goes this way, and then you have the thigh bone that goes down that way. Crude drawing. I never got any awards for my artwork. But let's draw the osteophytes now. So this is the hip bone, it goes that way, and then that goes over that way. The way an osteophyte works, or a bone spur, they're the same thing. The bone spur is just the common name, the nickname. Osteophyte is the sciencey name. Is you get, usually right here on the edges, a growth of bone. Sometimes it happens right here or right here around the neck. It can virtually happen anywhere that there's excessive pressure. And the way that I like to explain this, that makes sense to most people, is it's like a callus. Just like on your skin, maybe on your feet, if you have a part of your shoe that rubs too much against your foot, or like I have calluses on my hands from weightlifting because of the weight pressing against my skin. People that do work with their hands a lot, they'll get calluses on different areas of their skin. If you understand how a callus works, you're just rubbing the skin a lot, and as long as it's not too much and it doesn't break your skin, if you break your skin, you're going to bleed. You might get a blister before that happens. But if it's the right amount, you'll feel soreness in the area, maybe on your foot, and then your body, if you give it a chance to rest, it'll start to thicken the skin around there in response to the forces that you're putting through there, so that the next time you go do that activity, it can take it. Now, why do they develop right here? Well, in the hip joint, there's ligaments and muscles that attach. So if you're looking at an x-ray, that's how it looks, because it's bone that goes into the ligament or the tendon, and it's the bone trying to protect itself from breaking where the tendon or the ligament attaches, because there's so much force going through there. It's just excessive, and over time, the bone just starts to grow out like a callus to protect itself. So the problem then becomes, if you have hip pain, sometimes doctors will blame it, the red means pain. Sometimes doctors will blame it on the bone spurs or the osteophytes, and it might be true, we don't know. We can't definitively say that your hip pain is related to the bone spur specifically, but because it looks like an abnormality, it's not a normal thing to see on an x-ray, the osteophytes or the bone spurs, it will often get blamed. What I would focus on for you, Alexi, is fix the root problem of your hip problem. Fix the root cause. What I would focus on, Alexi, if I were you, is fix the root cause of your hip problem. Now, if you're dealing with like hip arthritis, if you're dealing with a tendonitis, a bursitis in your hip, or some other hip problem like a labral tear, chances are your glutes are not doing their job, and it's causing other muscles that attach in the area to pull too much here. Now, there's no guarantee that the osteophytes are going to go away, but what you can do is change the balance of muscles around your hip joints so that you stop putting that excessive tension on the attachment points of the tendons and ligaments, so that you're not making these worse. Absolutely, if the osteophytes grow to a certain point, just like calluses on your skin, they can become a problem. They can be painful themselves. They can impede activity. They can change the way the joint moves. And at that point, they may need to be surgically removed. That does help sometimes. But if you can fix the muscle imbalance and improve your hip situation, as you're saying that is already happening, then I wouldn't worry about trying to get surgery. I would see how far you can get as far as improving your hip problem without having surgery. And the hope, we don't know this for sure, but the hope is that, like calluses, this will start to go away on its own without you having to have a surgery. Now, I can't guarantee that's going to happen. I can't tell you that I've seen a case where that's happened, because most people that we help with hip problems, they get better and they're not getting a follow-up x-ray or a follow-up MRI to check on their osteophytes or their bone spurs. So I haven't had a case that we've gone back and looked. And even if they did and they're feeling better, I would say, who cares? Leave them there. Why go in and operate if your hip's feeling fine? So go after the root problem always. And if you're making improvements already with our exercises that we recommend, keep going. Go to the next level with those exercises and fix the root of the problem 100% and disregard the osteophytes if you're getting better. All right, our next question comes from Christina, and she asks, cartilage building scar tissue, how long does it take? I understand it may vary, but can you provide an estimate, please? Due to discomfort of serious osteoarthritis, I may need a cortisone shot to work through this, but understand this could impact growth of scar tissue. Your thoughts on both, and thank you for the healing work you are doing. Oh, you're welcome. I hope that it helps you and many people out there. And if you're watching this video and you've never commented on our videos, please let us know, because we need to know if you're being helped by our information. It helps us to continue making our videos. You just commenting, of course, helps with the YouTube algorithm and getting this video seen more. But more importantly, it's telling us we're on the right track. To answer your question, Christina, as far as cartilage building scar tissue, it happens much slower than any other tissue in the body. Of course, skin is the easiest example because you can see it. You've probably had a cut and got a scar on your body somehow, and that process takes maybe a week or two depending on how severe the injury to your skin is. If it's a very severe injury, it could even take a month or months. But when we're talking cartilage, as long as you're doing everything correctly, my estimation based on my experience in helping patients that I've seen, we're talking anywhere from 3 to 6 months once you're doing everything correctly. Now, what is realistic, because what I often see is patients that come to us have been dealing with the problem for much longer. Like if we're talking knee arthritis, hip arthritis, any kind of osteoarthritis. And they've been trying to heal essentially for 6, 12 months, 18 months or more by the time they get to us. So they've kind of got some chronic issues, and developing scar tissue is much harder at that point. But once we get them on the right track, then we're looking at just a few months of recovery. But if you're doing something that irritates the joints, that irritates the cartilage, then you're just delaying the whole process all over again. So work under that assumption. That's why in all of my recommendations, when I tell people about allowing their osteoarthritis to heal, I always say at the very beginning stages when it's painful, don't do anything that flares it up. Because it's just like having a wound on your skin. If you go pick at the scab, you're going to make it bleed all over again and start the healing process all over again. And you're not going to get that scar as fast as you could have if you had just babied it, if you had protected it and kept it from becoming painful again, from re-injury. Now, you don't get a scab on your cartilage like you do on the outside of your body. That's a different process because your skin protects you from the environments outside of you. But a scar tissue on cartilage will gradually develop, but understand how cartilage works. It's designed to cushion the bones on each other. So if you're over compressing the joint somehow because you're on your feet, because you're exercising in a way that uses it too much, if you're doing anything that adds too much pressure, and by too much, whatever it cannot take. Because you might be able to stand and be on your feet for a short time, but after a certain amount of time, or if you're doing exercise that loads it too much, then it becomes irritated. That's your threshold. You have to always know where your threshold is at and follow it. Once you're following those guidelines, then you're looking at 3 to 6 months. You have to be patient when it comes to cartilage. But as long as you're patient about it, the payoff is huge. You can avoid surgery, and more importantly, you can avoid a life full of chronic problems because you never solve the root issue, you never let the cartilage heal, and you're just going to be dealing with pain the rest of your life, chronic pain. Don't want that for you. So to answer your question, Christina, 3 to 6 months. If you've already been dealing with a problem before and it's been months, maybe even years, then I would look to double it. You're looking at 6 to 12 months. But at the minimum, 3 months, and that's rare that people do that, you're probably looking more like 6 to 12 months. Now for a cortisone shot, as far as that slowing down scar tissue buildup, I 100% agree. We know for sure in the medical research that cortisone slows down the inflammation process. It's an anti-inflammatory drug. Any sort of steroidal drug is going to help with inflammation. And we pose it that way in the medical field, that this is helping with inflammation, as if inflammation is a bad thing. But inflammation is a very important first step in the healing process, which ends in building scar tissue. So if you're getting cortisone injections on a consistent basis, which usually is every few months, then you're going to essentially be stopping scar tissue from developing. But it's a trade-off. You have to figure out, maybe you need it because the pain is so bad and you have to do that thing that you have to do and you need the injection, but you're willing to take that so that you can eventually heal. You're just going to delay the healing. What I always recommend, especially if it's a weight-bearing joint, like we're talking a knee or a hip, is get yourself crutches, get yourself a walker, get yourself a cane, offload that joint so you're not constantly irritating it and you give it a chance to heal. Once you're feeling better, then you can get off the cane, get off the crutches, and start to strengthen the right muscles, and you can get back to life as usual as that scar tissue lays down and you're getting stronger again. I hope that helps you, Christina. All right, one more question. This is from Linda, and she asks, because of your info, I am always trying to work on my glutes and hips. In addition to your exercises, I was wondering if kettlebell swings could have a place in my program. I always feel them in the hips and glutes. Absolutely, yes. I think that kettlebell swings are phenomenal. Let me show you how to do kettlebell swings properly to ensure that you're using the glutes, in case you're wondering. I don't have a kettlebell today, but I've got this dumbbell. We're going to pretend this is a kettlebell. Of course, the kettlebell has the handles, but you're going to just hold it right here in front of you. And to do a kettlebell swing, it looks like this. Let me just show you what it looks like, and then I'll break down the motion for you. So you're bending at the hips and pushing and going up like so. And when you push this way, you're doing a forward hip thrust, which is where you should be getting your glutes active. Because every time you go to push that way, glutes need to tension up tremendously. And that momentum that you build by pushing your hips forward is what helps you to swing the weight forward and up overhead. The mistake people make on kettlebell swings is they bend at their back too much. Instead of pushing forward with their hips, they're thinking about leaning forward with their chest and shoulders, and then throwing their shoulders and chest this direction and not using the glutes and using the momentum of their back and chest and shoulders to get the weight up overhead. And that's where you start to use these muscles up above, right here, rather than the glutes. But if you focus on sucking in your abs a little bit, the whole time that you're doing the kettlebell swings, and you're using your glutes to pop your hips forward, then you're going to be safe for your back, and you're going to be using your muscles appropriately for your hips and your knees. So it looks just like this in real time. And the weight is whatever you can comfortably do. Now, one more piece that I'll add in that I'm probably going to get questions on is, do I go just to my shoulders right here, or do I go all the way up overhead? I think that you should go up all the way overhead as long as you shrug as you're coming up. And here's the problem is you'll hear healthcare professionals, fitness professionals say, oh, don't swing the kettlebell up overhead, just stay shoulder level so that you don't mess up your shoulders. But the way you should do this properly is make sure that when you're coming up like this, that you're starting to shrug right here, and then maintain a full shrug when you're up overhead, and then as you're coming down, gradually reduce the shrug. If you're doing that, then you're going to be keeping the ball and socket joint of your shoulder, the AC joint, the shoulder blade, you're using the right muscles, you're putting everything in the way that, you're moving everything in the way that it's supposed to move, you're putting everything in the right position so that you're stacking the ball and socket joint on each other and you're moving with proper, good mechanics. If you're doing that for your shoulders, going all the way overhead should not be a problem. Now if you're concerned, don't go all the way overhead. It's okay, just do it to here. If you're focused on just your hips, no problem. But I would encourage you to work on getting all the way up overhead and make sure that you're sucking in those abs and tightening up those glutes. Well, I hope that helps you out, Linda, and everyone else whose questions I answered. Again, we're starting this new series called Ask Dr. David. If you want to get your question answered, join our channel membership and drop a comment on one of these videos. You'll have special badges that will appear next to your name when you comment, and so we'll know that you're a channel member. That way we can make sure to get your questions looked at right away and see if you can make it onto our show. Thanks so much for watching. I'll see you in the next video. Bye-bye.